Good morning. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today's Friday, January 29th, 2021, Friday morning, for our COVID-19 update. I appreciate you joining us. We're down a little bit. We're in the 40s and 50s because we've went a couple hours earlier, so some people may be having lunch or still maybe a late breakfast. But thank you for joining us this morning. This afternoon's packed with meetings. And I still wanted, before we go into the weekend, just to give you an update of how the week went. And the numbers continue to look good. And from a perspective of we're feeling a little bit of that stress and strain, not be as stressed and strained as it has been for the past couple months. We're at 15 COVID patients in the hospital today, 1 in the COVID ICU and 14 on the COVID floor. That 15 patients is the lowest number we've been from since Christmas Day, since December 25th. So over a month, that's the lowest number we've been. So that's a positive. And that day on Christmas Day was just a little bit of a drop from a few weeks prior. So if we continue to go down, we'll get back into the October, September numbers again, which would continue to lessen the strain. Now, we're not stopping. We're continuing to make improvements, continuing to add functionality, continue to do things in the room. So if we get another push or a fourth surge, we'll be ready for it. So we're continuing. And let's look at the numbers. You can see I've showed these each week, and I kind of like them, and some of you have gotten accustomed and really good at reading them as well. But this is our region, Region F. COVID beds is a percent of staff beds, and we're still around that 15% range, 15.73. Been there most of the week. So if you look at the 7 days, and this is as of the 27th, today's the 29th. So as of the end of Wednesday, we're in that 15% range, sitting at 15.73. Tyler, right there at that 16.27. So they've continued to go down all week from that mid-17s and just slowly going down, staying around. So we're continuing to decrease as well south of us. And then to the west, not as dramatic, but you can still see that big decrease on Wednesday, which Wednesday's a good day to have. In the middle of the week, when you usually have some of your surges, to see a decrease on Wednesday is a good sign. And they're at 2021 sitting on the 27th. When you look at the total numbers over the last 2 weeks, and that 236, I did a proposal. We talked to the board on Monday night, and I went back and looked at the last couple of months, and that 236, 238 was about our peak for this region that happened a few weeks before them. But we're sitting right now at 158. This is as of yesterday. So this is as of what was reported midday yesterday, sitting at 158. So continually to decrease. So almost, 100 down. We're getting close to that range of getting the 80, 90 down from a couple weeks ago. Same thing with the ICU, 18 down from our peak on the 19th of 68. So that's a big, when we talk about that strain, we only have 1 in our ICU today in the COVID unit. So that's a great thing to see as we continue to move forward in mitigating the spread. From a Tyler perspective, they're 588. 477. They're low. They hit their peak around the 8th of January, if I remember right from looking at some of the numbers. So continuing to go down 498 to 477. ICU beds down 40, almost 40 from the couple weeks ago or 10 days ago. And same thing with Dallas. Starting to see a big decrease over the last few days. Well, first time you've seen a significant decrease 2 days in a row west of us. So again, as we continue to see those numbers to the west of us and the south of us move us, we're kind of replicating what they're doing. So as we go into the weekend, it's exciting to see. Continue to talk vaccine. We'll continue to try and get as many people vaccinated. Again, we're at 2,100 vaccines. The county and my board has asked for some more information about just, where the vaccine's going and that stuff, and we'll be working on that information. So join us next week and try and get a little more information. We do have a couple phone calls today about the vaccine from the state and national level, so we'll take some of that information. So hopefully, if we continue to decrease the numbers in our hospital and what's going on, we'll be able to focus more on the vaccine and opportunities to improve our vaccination in the Northeast Texas area. Please continue to get on our waiting list. I just can't quit showing it. And we appreciate the Mount Pleasant Tribune. They did an article that's going to come out this weekend and talking about it. We also have a phone number that's going to be in the newspaper for people who do not have internet access. We're working on some functionality over the next few weeks to try and make sure we're getting everybody to get access to get to the webpage before they can get on the waiting list and other options. So our team is also working on some other things to do so we can improve the scheduling process that when we get it, we'll get it out quick to everybody. As we, as we continue to decrease in the curve and decrease the number of beds, that strain is getting a little bit better on the healthcare system. You know, I like to make sure we're focusing on other things. COVID's not the only issue we have. And we're still the largest cause of death in Northeast Texas is heart attack. It is cardiology, heart disease. And as we go into February, and it's hard to imagine, January's already over. So 1/12 of 2021 is behind us in a couple days. But Monday starts February, and February is American Heart Month. So you'll start seeing a lot of things, and I'll be putting some zingers in there about cardiology and the things that we're doing at Titus Regional Medical Center. You hear me use phenomenal a lot. You hear me use blessed a lot. And when we talk about cardiology, both those words come to mind. We have 3 phenomenal doctors in our cardiology department. And since about 2015-16, when Dr. Siegel and Dr. Abbas joined us, we've been 365 days of cardiology call, something we didn't have 5 years ago. But Dr. Sekulich, Dr. Siegel, Dr. Abbas are leading our cardiology program in Northeast Texas. And I cannot think of 3 better guys to lead that program and help work with our clinical team, our cath lab team, our ER team, our ICU team, our hospital medicine team to really push forward with cardiology care in Northeast Texas. The number 1 cause of death in our region. We are the chicken fried steak region. And one of the things we want to look at as we get further and further and use February as a jumping point. You know, I'm going to be doing a weight loss with some of the leaders in this community. They challenged me to get healthier. And this is a great month to start. You know, cardiology, American Heart Month. So you'll see some things in the next few days. I would encourage you, if you have any questions, check out our website. Check out the cardiology services on our website and some of the things that are going on. Check out our cath lab. But we'll be sharing those things with you in February as we really push for moving from COVID and focusing on some other things. But at the same time, I'm going to come back and hit you with that vaccine. So we're not going away. As other people start moving to other things, I would encourage you to tell you Titus is going nowhere. We're going to continue to focus on the issues, and as COVID still exists in this area, we want to get down to that's 1 and 2 beds and then get everybody vaccinated that we can. And then we'll go from there and find our next step that we can work together to improve the health care of our region. Thank you for joining us. I'm going to give you a few more hours today to enjoy your weekend, so please enjoy this weekend. Hopefully it rains fresh and nice outside where you can social distance, take your mask off and stay away from people, and just enjoy some of the fresh air for a day or two and make yourself healthier that way. God bless.